Welcome to the PT Walkabout podcast, a podcast that serves to inspire and inform listeners about physical therapy. My name is Dr. Lynn Steffe, and I'm a PT business and marketing consultant, best known for traveling the country both in person and virtually to help kick off, improve, and grow businesses. I wanted to share the gift of incredible insight to vital issues in physical therapy from interesting colleagues nationwide. We will explore the business of physical therapy, the role of physical therapy in lifestyle medicine, and actually all things physical therapy in order to help you grow your business. This podcast is offered through the generous support of our sponsor, alinea-engage. Alinea is on the forefront of digitizing your patient intake and driving loyalty before your patients even walk in the door. So this is Lynn Steffe, and I'm on PT Walkabout in La Crosse, Wisconsin at our spring conference. And my walkabout is all about the fact that the best journeys answer questions that in the beginning you didn't even think to ask. But I'm going to be asking you some questions today, and I'm here today with Bryan Heiderscheit from Madison, Wisconsin, and I first want to congratulate you on being a Catherine Worthingham Fellow, which I think is amazing and just makes Wisconsin proud. And I wanted you to give a little bit of further introduction about yourself. So
Sure.
what can you share? Not that people don't already know a lot about you. You're like kind of classically known as the PT running expert.
Sure. Well, thank you. I appreciate the introduction and the chance to be on. So my background and what I currently do is I'm a professor in the Department of Orthopedics and Rehabilitation, as well as the Doctor of Physical Therapy program at the University of Wisconsin-Madison. My role there is teaching within the PT curriculum, but I also do quite a bit of research as well as clinic practice. So I oversee and have directed and still continue to work in the UW Health Runners Clinic through sports rehabilitation. And I also serve as the director of research for UW Athletics and hold a weekly clinic for the UW athletes on movement-related issues. And definitely the focus is running.
Yeah, and so you're a little busy, and you're really well published too.
Oh, thanks, yeah.
And I know as I travel across the country and people are talking about running programs, I always offer up your name. I'm always bragging about Wisconsin people, but I'm always talking about you. So this is like an honor for me. So
That's great.
I just want to spend a few minutes with you because one of my passions really has become the role of lifestyle medicine and where PTs fit in that role. So I'm a huge proponent of physical therapists not only providing rehabilitation to an accident, injury, disease, whatever it is, but having a greater conversation with our patients about lifestyle medicine, and in particular, the role of exercise and activity. And so I just want to get a sense from you, if you're having a conversation like that with somebody and they're not yet a runner, should you be encouraging them to run? What are your thoughts? Is that a good idea, bad idea?
That's a great question, and I applaud your interest in that area, and I think that's absolutely an important part of the PT's profession is that continuum of care, and not just care from the standpoint of reacting to the injury, but trying to really take that proactive approach to prevent a lot of those what we think of as lifestyle type of injuries that come along. And I think running is one of those that can absolutely play a really nice role with it. I think that your decision, as you mentioned, about when and who is running appropriate for. So, for example, someone who is fairly inactive has really trying to just make those lifestyle changes to become more active. If their first dip of their toe in that active lifestyle water is to start running and to run a 5K, there could be some issues there for sure. But if they start out in a very common sense way and a very progressive way of let's do some walking with a little bit of 20 seconds of running, and then 20 seconds of running becomes 30 seconds of running, which becomes 50 seconds of running, and you do this very progressively over a month or 2 months, it can be a very good way to go at it. But that being said, I also very much caution people that you have to be careful with running, because out of a lot of the activities that we do, there's a lot of bang for your buck for running in terms of calorie burning and really getting a lot of good benefits from it, but it's also very demanding. And that's the reason you get the calorie burn, is because it is a demanding activity, not just physiologically, but also biomechanically. And if you're not biomechanically sound enough to tolerate running, then running becomes too much quickly. So one of the phrases that I've heard others use, and I like it, is you don't necessarily want to run to get fit. You need to be somewhat fit to run. And again, that doesn't mean that you have to be at your target level of fitness to begin running. You just have to have a certain baseline level to be able to tolerate the demands. One of the easy ways to do that, as I mentioned, is that walk-run progression is a good way for you to gradually build up that level of acclimation to it. Because even though running is something we can all do, all of our bodies aren't ready to take on that level of demand. And when we think about bone health and how your bones respond to changes in load, that's a 4 to 6 month process before you really start to see some effects from it. And so if you rush into too much, all you're doing is breaking things down rather than giving your body that chance to respond to that new lifestyle.
And I think that's something that a lot of people have a hard time with. They decide that it's all or nothing. Like, I've been doing nothing, but I want to run, and they ramp up too fast and they wind up injured, and then they wind up not doing anything. And so I know I ran in college, not a ton, but I lived with one of my roommates who's a big runner, so we would run usually almost every day. Like, I would run 3 to 5 and she'd run 6 to 8. So we were kind of running partners for part of the time at least. But then I didn't run for many years and just recently started again. But I think I kind of built up gradually.
Fantastic.
And you get aches and pains with running.
That's right.
And the whole thing is I tend to back off. Do you think it's better to start running or encouraging people to start running on a treadmill first or on outdoor, or do you think there's a preference?
Yeah, I don't think there is in terms of safety and risk of injury. I think it really comes down to what is the patient or the individual, I don't want to say patient, but the individual most motivated to do. Yeah. Are they if they run outside, is that more invigorating for them? Are they more willing to commit to it and follow through? Then run outside. There's no automatic safety benefit to running on the treadmill.
Okay. And then in terms of, if someone's not running at all and they're walking and they want to build up, and say they're a baby boomer, 50s or whatever, do you think it's good to encourage them over what period of time to get fit? And also, should you be introducing or talking about strength training or what are the maybe 2 or 3 things that you think would help that person? I definitely think that if we're having these conversations with patients and we're trying to encourage them, running is so accessible. And it just seems like something that we should have at least an idea on how to recommend.
Yeah, absolutely. The fundamental ones, when you think about what muscles and tendons and tissues in general are most exposed to load with running, your calf muscles clearly are. And when that means your Achilles tendon. And so making sure that you have an adequate level of calf strength, which is one of the first muscles to atrophy, and atrophy pretty significantly by the age of 30, 40, 50.
Really?
Absolutely. Yeah, we see changes in the Achilles tendon compliance starting at the age of 25.
Wow.
And so that part of it becomes, and the nice part is you can recover some of it with a good strengthening program, calf raises, seated, standing. There's a variety of iterations of it, but calf raises are fantastic. Another important muscle group are your lateral hip muscles, like the gluteus medius, those ones that abduct your hip or bring your leg out to the side. Those become really important again, and also from a standpoint of if you've led a fairly low active lifestyle, then those muscles tend to decondition as quickly as any. And from a running standpoint, those are really important because when you're running, you only have one limb on the ground at any point in time. So you don't have that opposite limb to stabilize with, which means those muscles have to work a lot harder to stabilize. So the demands on them go up. So those are 2 that are absolutely critically important. And then the last one would be the quadricep muscles. That's going to play a really big role in keeping you vertical. And again, people who sit a lot, or as we all do, unfortunately, with our lifestyles, that those muscles tend to weaken pretty quickly. And we know that quad strength is really important to prevent knee pain, which is one of the most common running-related injuries.
And I think one of the things that, so I have a particular interest in lifestyle medicine as it relates to brain health.
Oh, nice.
And so that's kind of my thing. And the challenge I always see with recommending walking programs is people really don't get their heart rate up sufficiently in some of their walking programs. It turns into what I term a strolling program.
Yeah, right.
And it's like, I almost feel like you have to push them to at least do some interval running, light running, or something to get their heart rate up, because I'm interested in that cardiovascular connection with the heart health, brain health, and then also brain-derived neurotrophic factor, which requires a certain level of intensity. So that's kind of why I'm thinking the running. So if you had someone who was, not totally sedentary, but typical, and they were working up, do you think you'd recommend, a ramp up over 30 days, 3 months? Do you have just like a ballpark or?
Yeah, so a great question. And there's been a couple of studies, if you want to go to the science side of it, that's really shown that, getting people ready to run a 4-mile race, for example, do you need to train for 8 weeks or do you need to train for 13 weeks?
Yeah.
And be more progressive over that 13 weeks versus a little more intense in the 8 weeks? Does your injury risk change? No difference.
Really?
Exactly the same. So I think a lot of it has to do with that. First off, there is, as you said before, there are aches and pains with running.
Yeah.
It's natural. And that should not scare you away or say that you shouldn't run. And so, unfortunately, many times those aches and pains we check those off as an injury box. But in reality, it's not. It's just an acclimation. It's part of the accommodating to the new task. So to get ready for, say, like a 5K distance, less than that 4-mile run that I talked before, generally speaking, 8 weeks is plenty safe compared to trying to say, okay, what if I did it for 16 weeks instead?
Yeah.
It's probably not going to be much different in the end in terms of your relative safety. Now, I absolutely caution people against 2 weeks or 4 weeks of preparation.
Yeah.
But 8 weeks is a totally reasonable amount, depending on where you're starting from.
Yeah.
Right? If week 1 is I'm going to walk for 4.5 minutes and run for 30 seconds and repeat that 6 times, then you need more than 8 weeks.
Right.
But to get to, as long as you're able to reasonably tolerate 15 minutes of running, 8 weeks later, you can easily do 30 minutes of running.
Yeah. Well, that's awesome. Well, that's all I really was looking for. I don't know if you have any closing thoughts on PTs having conversations like that with patients, because to me, that's something I want us to start thinking about instead of just thinking about let's get your pain down to a 3 or less, or you know what I'm saying, a range of motion or other things. I know that we have to work on functional stuff in order for third-party payment, and obviously it's an important part of what we do, return people to function, but I think we have a bigger calling than that. So closing thoughts on that, Bryan?
100%. I think, and especially in running areas, the runners that are at the highest risk for injury are novice runners. Those who are just getting going. And so much of that risk can be mitigated by education and just a few tips and tricks along the way to what they would eventually learn on their own. We just speed up that learning process and hopefully can mitigate a lot of those early injuries. And therefore, if you reduce those early injuries, you increase their risk of staying compliant with running, and that running is an option for them, and that they're not just going to walk away from running as an option for exercise.
Yeah, that's awesome. Thank you so much, Bryan, for your time, and thanks for hanging out in La Crosse and joining me on this little walkabout. So
absolutely.
Thanks.
Yeah, thanks, Lynn.
Thank you so much for listening to this week's episode of the PT Walkabout. Be sure to subscribe and share our podcast with your colleagues. We look forward to offering more great information to inspire you on the next episode of PT Walkabout.